practitioner with expertise in psychoneuroimmunology. She brings a unique perspective by examining emerging syndromes through the lens of human evolution. So please welcome Olivia. There you go.
Thank you so much for having me here. I'm going to assume you guys can all hear me. Perfect. Thank you very much. Okay, psychoneuroimmunology is a very fancy word for the science behind mind-body medicine. And I am a medical doctor that fell into it because I was observing in my patients that emotions, psychology, stress really made an impact on their disease progression, their disease initiation. And I wasn't prepared for this from medical school. So, what is it all about? Essentially, we have to understand a couple of fundamentals. Now, I've got 30 minutes, so you can imagine that this is just scraping the surface here. Maslow's hierarchy of needs has a lot that is desired, to be honest with you. There's a lot of things that are wrong with it if you speak to psychologists. However, there is definitely one thing that we can kind of all agree on, and it's this. At a fundamental level, we're looking at survival as our species sort of imperative, and then procreation and sex. Now, I've had some previous partners who sex first and then everything else later, but that's beside the point. The evolutionary bias of inflammation was first talked about in 2013 by Professor Charles Raison. And it's this: from an evolutionary perspective, any threat to our well-being, our integrity, our life, our health, was actually going to stir the immune system to bring on inflammation. Because inflammation, despite what you may have heard, in the short term, it's protective, it's regenerative, it's rejuvenating. It's when you have complex chronic inflammation, that's when you get all those diseases that you would have heard about. They're Neolithic diseases, right? So your cardiovascular issues, type 2 diabetes, dementias, depression, all of them have a proper hardcore root in inflammation. But from an evolutionary perspective, if something even looks at you sideways, your immune system is going to have to make a decision. Am I going to turn on inflammation and possibly help protect this animal, or not? And that's where experience comes into play. That's where your perceptions comes into play, your SNPs, your evolutionary history, your ancestry. So it's this. Does this work? We have so many different stressors now in modern society that is no longer just being ripped into by a saber-toothed tiger, or fighting with Krog from the next village who wants to steal your rock collection, or pathogens, which was the #1 reason why we were taken out of the gene pool. Because if you fought with Krog and you sustained a cut, if your immune system didn't balance appropriately to those invading bacteria, viruses, and so on and so forth, you were out of the gene pool, you were done. And now, threats. Doesn't matter what it is. Being indoors on a sunny day, for example. Not enough sun exposure, the chemicals in our food, chemicals in our water, our toxic relationships, our self-worth. All these things can be perceived by the immune system, by the neuroimmune system, as threats. And we know very well how stress can induce an inflammatory response. And if sustained, that's chronic. And when it's chronic, it's damaging. We know this. I'm talking a lot about stress, but that's because we have an evolutionary bias to look out for things that are going to take us out of the gene pool. So I know that the talk is mind over matter. The psycho in psychoneuroimmunology, the psycho does take into account stress. We all know that's detrimental, but it's also mindset. It's also emotions. So, psychoneuroimmunology is that intersection point between psychology, behaviors, the nervous system, immunology, and endocrinology, and how each of these things affects each other. It's bidirectional. You can use behaviors to change your hormones. You can use hormones to change your immune system. You can use immune system to change your behaviors, and so on and so forth. And this is not new. This is from Nature. Nature is one of the world's best medical journals. Specifically here, they're talking about childhood adversity, issues when you're a child that actually sets you up for inflammatory conditions later on in life. But you know what? It's not just childhood. We expose ourselves now to threats and don't mitigate it, don't understand it, and allow our neuroimmune system to go wild. We can have unfettered immune and inflammatory issues. So I'm not going to belabor this because this is actually part of a much bigger talk. I may or may not have thought this talk was an hour and recently sent my slides in about 5 minutes ago. Anyway, the threat detection system of the body is the fact that redundancy is built into the system. You are going to have lots of different ways for the body, the brain, to take in information from the external environment and the internal environment because it needs to know, are we at risk? Are we at risk? Are we at risk? And usually it does try to correlate those inputs between different systems so that there's coherence. The more stressors, the more threats you have been exposed to, the less they talk to each other because it's shoot first and fire later. Shoot first and ask questions later. It's kind of like a house, right? So let's just say, I mean, everyone knows that the Canadians are like trusting and what have you. And you don't even lock the door to your house because you trust society. Okay. If you hear a sound at night, you're going to wake up and like in the movies, you're going to go look, is there any issues here? Are there any issues there? And we're all in the cinema going, no, don't. Because we've seen that many movies. We know that, this character is about to... And then you realize, okay, no issue. But one day when you do that, there is an intruder in your home. What do you do after that? You start locking your door. Your anxiety isn't appeased. You start sleeping with a baseball bat by your bed. You start putting bars up on your windows. You start getting an alarm system. And the more you feel that there's a threat, real or perceived, right? There's break-ins in your neighborhood, for example. The more you're going to be so twitchy, you hear a sound late at night, and by the way, you haven't been sleeping now. You hear a sound late at night, you're going to shoot first and ask questions later. And this is an analogy for the nervous system. So, we all know about the placebo and nocebo effect. The placebo is if you expect something good to happen, it will. The nocebo is if you expect a negative outcome, it will happen. It's very well documented in medical trials. In fact, a lot of the time they'll kind of gloss over this because it messes with outcomes, to be honest with you. Placebos even work if patients know they're getting a placebo. Something amazing about the body. The main thing to know about placebo and nocebo is that it is proof that healing can start in your mind. This is pretty much the first study, 1975, that showed that you take out the psycho part of this. This is rats, right? Rats who were given sweetened water, saccharin-laced water, and given cyclophosphamide at the same time, which is an immune suppressant, right? After about 6 weeks or so, you can just give them saccharin-laced water, and their immune systems would crash, and some of them would die. Kind of a little bit Pavlovian, right? But it's showing you that this psychoneuroendoimmunology system is so intertwined. You shouldn't be pulling it apart. We are a whole person. So, stress, emotions, mindset, but stress, and gastroenterology. We know back in the day, maybe about 20 years or so ago, IBS usually came on in majority women in their 20s during university exam periods. It's the first time we started talking about this fandangled thing called IBS, which for many years you were told, right, no such thing. It's in your head. You need to relax. You need to get on a SSRI. But we absolutely know how it induces alterations to the neuroendocrine immune pathways. And therefore, IBS and IBD and IBS-like symptoms, which don't fall under that particular categorization, actually does matter about your stress responses and your perceptions about what's happening in your life. This can be very touchy, right? So I'll just say this, the International Psycho-Oncology Society, and yes, their website is International Psycho-Oncology Society.org, actually talks about the fact that distress should be measured as a 6th vital sign. The reason being, it makes such a difference to your prognosis, to your quality of life, to how you respond to treatments. You need higher doses of certain medications if you are highly stressed, for example. And this is an interesting case from the late 90s. There was a man who was told that he had metastatic carcinoma of the esophagus. He was given 3 to 6 months to live and dutifully died within 3 to 6 months. When they did an autopsy on him, he didn't actually have metastatic carcinoma, and he had a tiny lesion in his liver. The author of the paper said, if we can cause death by what we say or do, then what lesser behavior do we induce in our patients? Can diagnostic labels of serious or life-threatening diseases, whether correct or not, be part of this general phenomenon? It's the difference between saying to someone that they're in remission or cured, whether it's acute or chronic, whether it's progressive and that you will never be able to get rid of this label, like up until literally now, they were saying about type 2 diabetes, right? When I was going through medical school, you could never be cured of type 2 diabetes. It was progressive. I think all of us know ourselves or someone who's had worse skin outbreaks or flares of their eczema with stress. But the pathways are incredible. Part of it has to do with the fact that from an embryological perspective, egg, sperm, 2, 4, 8, 16. At some point, you divide into 3 germ layers. You've got the ectoderm, the mesoderm, and the endoderm. The ectoderm winds up becoming your brain, nervous system, nerves, and your skin. There's a very special relationship between what you think, how you process stress, and your skin. So many, if not most actually, chronic, complex conditions, which has a stress component to it, has a cutaneous manifestation. And this was the first study that actually showed the detrimental effects of stress, where these people actually had much slower wound healing if they were in stressful situations looking after family members or friends with dementia. That was 1995. I have absolutely seen this in clinic, where patients' stress resilience changed the course of their HPV disease processes and led to either remission or dysplasia, which is that precancerous state. Again, we have to be very careful as doctors when we're talking about these sorts of things, because absolutely am I not saying that this is all blamed on the patient. What I'm trying to impress, and the other doctors in the crowd as well, is that you have agency, you have autonomy. We are here to help. We need to stop labeling you, and you need to stop embodying and being your diagnosis. So Takotsubo's cardiomyopathy was first described after the wars, where you actually have women coming into a hospital with what looked like a myocardial infarction, a heart attack. And these women would be worked up, and they wouldn't have any markers of heart cell death. But you do an X-ray, and the heart goes from this to this. Takotsubo means octopus trap. It's a Japanese word because the octopus trap looks like this. And it was, unfortunately, a malady that would mostly affect women, especially women who had been affected at that stage by the loss of their husband, the loss of their sons in the war. The one thing that we do for these women, support. We give them emotional support in the hospital. They get better, they go home. We get taught this in medical school like it's some sort of like curiosity, as opposed to, hang on a second, how can you have such a profound physiological response to stress? And in the literature, we have now discovered over the last few decades, it's divorce, car accidents, men as well, of course. It could be the death of a child, stress. Okay, so I'm going to go from stress, death, dying, cancer, to more uplifting stuff. I say mindset and eating. In part, this has actually got to do with mindset and hormones, because there is actually a paper, it's called Mindset Over Milkshake. And essentially, the two groups of people, one was told that they were getting an indulgent shake, right? And the labeling looked all, indulgent. And the other one was a sensible shake, right? In reality, both of them were given 300 calories. The ones who took the indulgent shake, their hormones were 300 times less with ghrelin, which is a hormone that you release when you want to induce hunger. And so it's not about ghrelin, insulin, glucose binding onto receptors. That's how I was taught in medical school, right? It's also in part how you think about what it is that you're consuming. Try it, you'll like it. This study basically showed that you have groups of participants, there were 3 participants, 3 groups, and you can add vinegar, but if you call it a special ingredient, people are like, oh, yes, I do believe it. I do believe it tastes better, right? When you tell them the special ingredient is vinegar, it's, no, don't like it, terrible, right? So let me tell you, okay, there are marketing experts out there trying to sell you stuff, and they know this. Marketing manipulation can actually also make you change your perception, your feelings, your hormones about certain things just by how they market it, as far as like the packaging, for example, or the price point. So I personally do the Homer Simpson way of buying wine, the second cheapest one, but I don't know how you guys do it, but just be aware of this. There are predators out there. Mindset and exercise. So this first study was that they went to a hotel, and the housekeeping staff were told, they were divided into 2 groups. In one group, they were told, what the work that you do in the hotel, cleaning and moving and all the rest of it, actually meets the Surgeon General's criteria for exercise. Okay, and the other group were told no such thing. At the end, compared with the control group, the group that were told that their work was exercise decreased their weight, their blood pressure, their body fat, their waist-to-hip ratio, and BMI. In another study, if you tell someone that the exercise regimen that you're doing, that I'm giving you, is individualized, it's for you, you actually do better out of it than if I just do a broad strokes exercise plan, right? And finally, this study here at the bottom, they took 2 groups and they actually immobilized their forearm and their wrists with a cast. And it was 6 weeks. In one group, they were told nothing. In the second group, they were told, I want you to think about going to the gym and actually picking stuff up and doing your exercises, right? In the group that did think that they were going to the gym for those 6 weeks, they had 200% less muscle atrophy. This is my exercise regimen, so follow me for more tips, basically. Okay, so originally I think someone said that my talk was going to be on longevity. And you know what? It kind of is, right? Kind of is. Because can you imagine if you could use your mindset to be more supple, improve flexibility, manual dexterity, right, left, memory, cognitive behavior, have more fluid in your intervertebral discs so that you actually stand taller and are taller, improve your sight and hearing, and look younger subjectively to people who see a before and after. Is this even possible? Counterclockwise is a study from 1979. It was run by Ellen Langer, who's a very famous psychologist. And what she did, and her team, was they got I don't know why this makes a difference, but anyway, it was a monastery. And they decked out the monastery as if it was the 1950s. And they had a group of men who were in their 70s, and they asked them to go into that monastery for a week. And they said to them, pretend you're back in the 50s. So they had to talk about current affairs in the 50s as if it was happening there and then. There were no mirrors in the monastery, and they had photos of themselves from when they were younger. Newspapers, magazines, TV shows, music, all from that era. Men walked in with walking sticks, walked out without. Men walked in with wheelchairs, walked out with walking sticks. They were playing football at the end of the trial. It was profound, and it was so profound that even Ellen didn't believe it. So she sat on those results for quite a while until she did other studies to kind of pad out, to sort of prove what she was saying, and then she released the results. And of course, wow. Do you know when I found out about this study? Last year. Why? It's such a profound thing that we can be saying to our patients, that their mindset, that their emotions, that how they feel about themselves, their self-worth, their self-compassion can make a difference. And you know what? I deal with complex chronic conditions, okay? Which means that 1% of increased function for my patients makes a difference. Because I don't know if you know, but 100 times 1% equals 100%. So this is an actual study that happened. And in fact, 2019, they're actually doing an update of this study. It got sideways by COVID, but anyway, I'm looking forward to the new results. Mitigation. So I know that all of you know about sauna and cold plunges and all that sort of stuff, so I am not going to belabor the point because they are absolutely beneficial, right? What is hormetic stress? Small stress that can give you long-term benefits. My message here is about nuance, right? What is low for you today may not be low for you tomorrow. And it especially shows, it's especially so for women during our hormones. Our luteal phase means that we shouldn't be hardcore hit sauna for 20 minutes and then cold plunging for 3 minutes. You do what feels right for you, and that changes. Don't be fooled by a prescription given to you by some influencer or biohacker online who are very well-meaning, but you know your body best. Earthing electrons from the ground, right? It's an important part of what we do, going out into nature, blah, blah, blah. Why? Because we're going to quantum tunnel electrons through the protein complex, helping to move the hydrogen into the intermembrane space, making more ATP. Okay, that's in part why we do grounding. Cold thermogenesis, cold plunges, how does that benefit you? It helps by increasing the brown adipose tissue, helps to uncouple the mitochondria. And what does that mean? It means it moves the hydrogen into through the inner membrane space without going through the ATP synthase. I'm going to be quizzing you on this, by the way, later on. But how does that help? So it decreases reactive oxygen species, so on and so forth. There is real science to what's being talked about here. And I just wanted to talk about the fact that mitigating stress is in part going to be with what you choose to do, whatever you choose to do that sings to you, not what's prescribed to you. Last slide. emotions and feelings. An emotion is a feeling where if your brain perceives a threat, that it thinks, notice that it thinks it needs to react to, that emotion or feeling is going to be that precursor, right? It is an impulse for the likely action that follows. I really talk about emotions and feelings with my patients because we all have them. But when you're sitting with yourself, especially when you have a scary diagnosis and it's just you, in part, this is going to massage your neuroimmune system if you have some control, and you do. The context of the situation, of course, and your prior experiences is going to influence whether you interpret a sensation as anger, or frustration, or attraction. Ooh, this is a hard hill. I'm going to face it. I'm going to climb it. Not all of us are so lucky to get there, right? But the fact of the matter is, it's a practice. So let's practice. Conclusion. Psychoneuroimmunology is awesome. It is absolutely how you are able to take control of all the different aspects of your body, of your mind, of your emotions, using different levers. It doesn't have to be a behavioral change like sleep. It doesn't have to be supplement. It doesn't have to be. You can influence all different parts because it's bidirectional. Self-talk matters, absolutely. The challenging limits things is this. When someone tells you what is or what isn't, you decide that for yourself. You don't let a doctor basically point the bone at you, ever. And if you manage stress and improve your relationship to self and others, if you're able to really get on top of your emotions and your feelings, you are going to live definitely a healthier, happier life. I'm not sure about longevity, but probably. Thank you very much.
Thank you so much, Olivia. Yeah, you need to put on the headset. We have a couple of minutes for questions. So, any questions? Yeah. And we have a mic there. Yeah, super. Thank you.
Thank you for an amazing presentation, Olivia.
Thank you, Anita.
My question is that you're talking about that a lot of people were then told by doctors, they were told this and they were told that, and then they believed it. How would you then approach it if you want to be able to tell yourself without having that external person that you have trust in? And then how do you trust yourself on these things?
I know, and that is absolutely something that's happened recently, where patients, I have this, I have a little video on my Instagram. A few years ago, I had a patient whose Oura ring, when he woke up, said that his readiness score was shit, and he was really upset. He had stuff to do that day. His readiness score was rubbish. And he called me up in a frenzy. He's like, I didn't change anything yesterday. I did this, I did that. And we were like working it out together. Okay, what about the lighting? And what about the temperature of the sleep? And eventually I was like, wait, okay, hang on a second. How do you feel? And he said, I feel fine. I feel good. I said, well, there you go, right? It's this reconnection with self that I think needs to be the sort of like game, the name of the game over the next few years, because we are so reliant on what other people are telling us, what our childhood dictates and our childhood traumas. When I say this, I don't mean that trauma doesn't make a difference. It absolutely does, but it doesn't have to define you, right? And so this sort of like, whatever it is, somatic therapies or going back into yourself and checking in and, you know, not being beholden to your wearables is going to be, it's a journey. It's a journey.
Thank you so much, Olivia, for joining us here at Copenhagen Health Week.
Thank you. Thanks very much.